Well, there was several studies that showed that there was an increase in incidence or the amount of disease in the younger population over the last 20 plus years. And it's alarming, right? This is pancreatic cancer. It's a potentially deadly cancer. So there were a number of news publications that described this and papers that demonstrated this. There's a paper in JAMA, a research letter in 2021 that looked at about 20 years worth of data in SEER, which is the kind of national cancer database that we use as researchers. And it was showing this alarming rate of increase of pancreatic cancer among Americans under the age of 55, and even more so among people that were under 40 years old. And so that paper got a lot of attention, and it kind of made us as researchers on this paper ask, well, if the incidence has gone up, what about the outcome that is the feared outcome of getting a disease, which is death? Has that gone up? Has mortality gone up? And so that was the genesis of this paper. So when you see more disease in a population, you usually, if it is actually true disease occurrence, you should see an increase in mortality. And what we showed in people that had been diagnosed with pancreatic cancer under the age of 40, so between 50 and 39, that the mortality rate has been flat over the entire last 20 years, despite a doubling of pancreatic cancer in women and a over 1.5-fold increase in pancreatic diagnosis in men. And that was kind of surprising. So when we saw this signal of a lot more cancer diagnosed and flat mortality, the next question we wanted to know was, were people that were being diagnosed with pancreatic cancer actually also undergoing surgery? And what we found is, yeah, surgery rates for pancreatic cancer actually went up over time. And so it is possible that some of these surgeries were unnecessary. And the other thing I want to point out too is we went a little deeper into our analysis, where we not only looked at pancreatic cancer as one collection of diseases, it in fact has many different histologic subtypes, adenocarcinoma being the dominant subtype and the most feared subtype that is associated with the most death. And there's also endocrine tumors or neuroendocrine tumors of the pancreas. And it was those that were increasing at the highest rates over time, particularly in women. And what a lot of research has shown in the past is many of these cancers are actually indolent and don't necessarily need surgery. But our finding that surgery rates were going up means that a lot of people, especially younger people, are probably undergoing this surgical procedure, and many of them may not actually be benefiting. So at the outset, I want to say it is impossible to know which patients that were diagnosed with pancreatic cancer, specifically neuroendocrine cancers, had appropriate or inappropriate surgery. But what is true is that undergoing surgical treatment for pancreatic cancer is could be linked with potentially higher rates of complications like pancreatic fistulas, infection, exocrine or endocrine insufficiency. And it is well documented that 30-day mortality rates for surgery of the pancreas is anywhere from 4 to 8%. And so if you're undergoing this surgery that's potentially life-threatening and certainly life-altering, some people are undergoing this procedure for a disease that may not have actually caused them any harm. The U.S. Preventive Service Task Force, it already recommends against screening for pancreatic cancer. I mean, the last time they looked, they gave it a grade D. But in some ways, our study reinforces or supports that contention. Because if we started looking harder for more pancreatic cancers, we probably would find more indolent pancreatic neuroendocrine tumors, right? And we would probably end up overtreating a bunch of people with the desire of trying to find the people that may benefit. But what I hope our study helps people understand is that just because there's a rise in the incidence of cancer, it does not always mean that rise in incidence actually matters to the thing that we care about the most, is death from that cancer. And so this is a signal, even in this potentially deadly cancer, of overdiagnosis. And I want also to make sure that further studies and future studies really investigate kind of active surveillance as a way to handle this diagnosis, especially in young patients. Currently, we don't have immediate plans for a follow-up study, but I'd like to point to the European Neuroendocrine Society, Tumor Society, that's conducting a prospective trial looking at managing patients with active surveillance and the outcomes associated with those, whether it's quality of life or survival, et cetera. They had an interim analysis a couple of years ago that showed some promising results for active surveillance, but they're still recruiting, and I'm not exactly sure when the trial is going to close. They're trying to get 1,000 patients. In their interim analysis, they had about 500, 540 patients. But waiting for those results, I think, will be really informative for the field.